It has been said that the only thing predictable about influenza is that it is unpredictable. And this year's flu season is no different. With me today on Missouri Medical Focus is Linda Johnson, manager of the Infection Control Department at University of Missouri Healthcare. Linda, given what I just said about the predictability of influenza, is there a way to describe what we expect a flu season to be like as far as when it begins, peaks, and ends?
We expect the flu to occur in the fall and winter months and sometimes in early spring. As far as when, it varies from year to year. Once it starts, we expect that it will go up over a several-week period, peak, and then go back down. That's about as much as we can say is a normal thing. As far as when it occurs, varies every year.
What has this year been like?
This year we have had what we would describe as an earlier flu season. We have had widespread influenza in Boone County, and most of those have been influenza A. We have had a very low level of influenza B activity and have not seen any peak in that activity yet.
There was also an issue with this year's vaccine. Can you tell me about that?
This year we had what is called a genetic drift, which means the influenza that we are seeing is not genetically as close as we would have liked to the type that was used in the vaccine, and that caused us to not have as much protection against influenza activity from the vaccine. However, the vaccine still provides some protection and still prevents the infection from being as severe.
Yeah, I think I read the CDC reported about 48% of flu samples were related to this year's strain, meaning 52 were not. Does that sound correct?
That is correct. We are still seeing a lot lower numbers overall of influenza than we would see if we had not had widespread vaccination. And what we have seen, even in those that are sick, is that they are not getting as sick as they might have had they not had the vaccine.
So it's still offering protection. Would it be important to get vaccinated at this point if you haven't already, or has that ship sailed?
No, I think it's still important. It would still offer protection. It is very important to get the vaccine. We have not seen any peak in our influenza B activity yet, and so we expect that to occur, and the vaccine actually offers protection against two different B strains as well as two A strains, and how sick you get from the actual disease is reduced with the vaccine, even if you go ahead and get the disease.
You're listening to Missouri Medical Focus on KBIA 91.3 FM, and our discussion is about influenza. Linda, how can you tell that you have influenza over, say, a common cold virus?
That's an excellent question. One of the main reasons you can tell you have influenza versus a common cold is how quickly it comes on. If you feel fine, and then within an hour or two you feel very, very ill, you develop a cough and high fever, you probably have influenza. A cold normally comes on much slower over a day or two. A cold, you also don't normally develop near as high a fever. It's usually a low-grade fever, where influenza is a much higher fever. Both of them can have severe coughs. A cold would have probably a lesser degree of illness, though we've all had common colds and we all can feel pretty miserable with a cold. We feel much worse with influenza, and it's a much more severe respiratory type of illness.
At what point are you considered contagious with influenza?
When you start to develop that fever, you are probably contagious at that time.
Okay, and then when does that end?
What we tell people is that we would like for them to avoid being around other people for at least 24 hours after they no longer have a fever, without the use of anything to bring the fever down. So without the use of aspirin or Tylenol, and they still do not have a fever, then they are probably not very contagious at that time.
How long do symptoms of influenza last?
For the average person, it's about 7 to 10 days without treatment. Treatment with Tamiflu or other antivirals may decrease that to a shorter time frame.
And that treatment has to begin within 48 hours of onset of symptoms, correct?
If treatment is delayed beyond that 48 hours of onset, it really doesn't offer any shortening of the course of the illness.
We talked about the importance of vaccination. What are some other ways to prevent influenza?
The most important thing you can do is to wash your hands. Use hand sanitizer. It's very important you get rid of those influenza bugs, and we touch our face, the average person, several times an hour. When we do, we transfer those germs from our hands to our eyes to our mucous membranes, and that's how we get the disease. Every time we touch a doorknob, when we touch surfaces, if someone with influenza has walked by and coughed on it, we know the influenza can live on those surfaces for 20, 30 minutes, and it is very easy to transfer influenza from one person to the next.
Is there anything that I missed or something that you think is important to add?
If you are sick, stay home. It is important that you don't go out and share your influenza with other people. Even if you are a young and healthy person and it's something you think you can work through, not those around you. There could be many people around you who aren't as young, aren't as healthy, have underlying health conditions, and your influenza that you share with them could be life-threatening. Secondary infections, whether they're viral or bacterial, are the most common cause of death with influenza. Patients develop influenza, their immune system is weakened, and they develop a secondary bacterial pneumonia, and that is what causes the most common reason for patients to die.
My thanks to Linda for being on today's program. For Missouri Medical Focus, I'm Jeff Helsher.